Welcome back. In your morning medical news, the World Health Organization is warning that Trump administration cuts could reverse decades of progress in maternal care. The WHO says these recent funding reductions are having drastic repercussions on pregnant women in multiple countries. Maternal deaths had declined 40% globally between 2000 and 2023, but the slashing of humanitarian aid earlier this year now forcing clinics to close and vital services be eliminated. Health officials warn thousands of pregnant women and newborns are now at greater risk. And federal health officials are reviewing fluoride in drinking water across the country. The cavity-fighting additive has been used for decades. The review follows an August report that linked higher fluoride levels to lower IQ scores in children. Fluoride has been added to water since the 1940s and is credited with major reductions in tooth decay. The EPA sets the official limits for fluoride under the Safe Drinking Water Act.
Now we know that there is no systemic advantage, zero systemic advantage, and that the only advantage comes from topical application.
So what EPA is going to do is go back and look at these studies that have come out since July of 2024, and we're prepared to act based on these science.
The CDC, the American Academy of Pediatrics, and the American Dental Association still support fluoride as a safe and effective way to maintain dental health. April is Parkinson's Awareness Month. Nearly 90,000 people in this country are diagnosed with that disease every year, according to the Parkinson's Foundation. Because many early symptoms may be subtle or not specific to one disease, health officials believe many people could be living with this illness without knowing it. Mandy Gaither has the warning signs for us.
Behind Alzheimer's disease, it's the second most common neurodegenerative disorder in the U.S. Parkinson's disease affects the central nervous system, causing people to have difficulty controlling their bodies, and it worsens over time. Dr. Sanjeet Grewal with Mayo Clinic says one of the earliest signs can be a slight tremor or shakiness, sometimes in your thumb, index finger, or chin.
One thing that's important to note with Parkinson's is often it's asymmetric, which means it starts with symptoms on one side and then can develop to having symptoms on both sides.
In addition, other warning signs include stiffness, difficulty with movement, freezing of gait where a person has a hard time starting to walk, a face that becomes expressionless, the person can no longer show emotions, speech may become softer, and writing may start to look smaller. There may also be a sleep disorder that develops,
where patients will start acting out their dreams and they'll start to get very, very physical in their dreams.
Grewal says patients may also develop a stooped posture, like they're leaning forward. There may be blood pressure issues, a persistent loss of the sense of smell, and dizziness when the person stands up. Constipation may also be a problem.
If we can catch it early, we can treat it early.
Right now, there is no cure for Parkinson's, but the doctor says aerobic exercise may slow down the onset of symptoms and improve quality of life.